Hi guys. So it's been a very long time. So basically, I just thought of updating about my life because it's been like 3 4 months. I haven't really uploaded anything about what's going on in my life. I am finally done with my final years and currently doing my internship in Guranak, which is my college. So my internship basically started during December. Like my first posting was Prostho, which probably you guys have seen in shorts. Then I had my Perio posting, which was easy uh, in comparison to Prostho. But then I had my cons posting last month, and now I'm having my oral surgery posting, and that's quite difficult, in internship we have to do OPDs, so there is the duty roster, there are days allotted, we have to do the outer patients, and then we have to do the extraction, and there are minor OTs as well. It has been quite hectic this few months to like properly take rest. Our college has so much patient flow, we just can't breathe, we just can't have our tiffins, it's so much hectic. In Prostho I did CD along with 2 3 RPDs, and I was amazed, like how could I do that? I mean, when I was in my third year final year, I think we all have done like one RPD in one posting, another RPD in another posting. How we did 3 4 patients together in one single month without being like, oh my god, what to do, because that pressure of proving yourself in the exams is now gone, and you are just practicing, you started your practice on patients management and everything. I think that's the best thing about internship. But I still will say ki, you know why I say it first year is really like, wow, look at this, that's beautiful, isn't it? So yeah, life is pretty good if you observe. But let's get back to it. What I understood with this, with my 4 years of experience, is first, second, third, and final years are so different than internship, and it is focused fully on the academics. Not much of a clinical things you learn, but you know, since our field is all about doing things on patients, we have to treat patients. It's very difficult for a student to understand what really is going on. I mean, you have to focus on your studies to pass the exams, but you also, in reality, you have to manage patients. I mean, if you are a brilliant student and if you don't know how to manage patients, nothing will matter much. I mean, uh, it can matter, like you can get a job in academic field, like as a teacher, uh, like only getting like without doing any chamber, you can just teach students. That's a thing, like that's a thing. But in reality, if you are going to do your clinics and practices, then you have to be good in your clinical work. So I think first, second, third final year has not taught much of a clinical work, because we did things out of obligations, that we need to like pass the exam, we need to do the quotas, we need to complete, we need to get the signatures. That's are much more important than anything else, I guess. And in my internship, what I understood, okay, now I am very much, what should I say, I'm much more calm and quiet and understand things, and I don't panic much. I feel that now I literally need to learn about the real things. It's not doing. It's not like running anymore. It's like understanding, taking breaths, and pausing for a moment, and then again starting, because I don't need to prove myself in the examination hall, in the papers, right, in the viva table. So it's like much more mature. Like since December, I'm wearing scrubs. There is literally no dress. In cons, prostho, and like OS, you have to clinically perform everything, and it is quite difficult. But also at the same time, I am much more confident, because I did CD, I did RPD, I also did broken denture repair, and in prosto also I did OPD. So that was a pretty cool thing. I think I have learned a lot, and I think I have progressed, and it's easier than before. And also in perio I did scaling is not much of it, but it takes a lot of time if you have stains and everything. But yeah, definitely people have a mindset, a lot of mindset, like scaling will do nothing, scaling will cause harm to your teeth. So at that time I have to make the patient understand why scaling is important, and in a very general manner, not in terms of academic way, but in terms of how patients, how you are making them understand, so you get an interaction with them. Then you get to go to cons, and of course it's a brilliant department. I have always loved cons, like the restorations. It's not only about amalgam anymore, it's about composites, and then GICs, and then a sandwich technique, and like the base is GIC, the upper part is composite, and it's cool. It's cool to see how, like, we can relieve the pain, we can give a beautiful structure to the tooth, we can prevent everything. Best part is I did RCT. Yes, I did RCT, and we had the preclinical thing, so it took 2 weeks to do. Okay, and we were very frustrated ki nothing was getting signed, and we were not able to understand what to do in our city. So we had to like do the preclinical in the central incisor, then in the canine, and then in the premolar. So I got a patient where I had to do the RCT in 1-1, and it was a success. My teacher said to me, like, it's okay, you don't need to hurry up, it's okay, stay calm, it's okay, you will be able to do, and do it in a fresh mind, because we're doing it for the first time, so it will take some time. And then I was like, okay, calm down, Pooja, it's not final year anymore, it's internship, relax. I asked him to come the next day, and I did the obturation and everything, and finally everything was okay, and I did composite. So that was pretty cool. I felt that, oh, I can do it, it's not that hard, I can do it. And also I did a hands-on, because my college had a conference, so I had a hands-on on rotatory instruments. That was again RCT, so I had my RCT done like the normal RCT that we do, but we are not allowed to do the rotary. I did use rotary hand instruments, and it was another wonderful moment for me, because I was learning, and I think I can do it now. And in OS, the beautiful thing is, when we are doing the OPDs, it's like you have to consider the medically compromised patients, and we have to see there is hyperglycemia, there is hypoglycemia, you have to check it. If there is thyroid, you have to check the levels of T3, TSH, T4. And if there is asthma, you cannot give certain drugs, because NSAIDs are not allowed. So you understand ki what to do, like how to manage patients, and what to do. And then in extractions, I did extracted 8, 3, 2, 8, 4, 8. I did that. Not the critical one that we are not allowed, but I have definitely assisted extractions with periapical cysts, and I'm pretty confident about the local anesthesia I'm giving, like the GP, infiltrations, INV, and everything is pretty good going. Not failing, and I'm like, thank God, it's not failing. So of course, that were pretty good experiences I'm having right now, but it's very hectic. I just can't like enjoy every single day. Like, I had to take breaks by my own to feel that I need to take rest, because I'm not getting the rest. Like, neither of my batchmates are getting the rest who are posted in the same department. So yeah, from the next month I will be having pretty boring postings, I guess. But I'm also excited, because next month I am going on a vacation trip with my college batchmates. Happens yearly during the internship period. Like, my seniors had also gone to this vacation, and so I will not say which place. Maybe I will give a vlog about it. And yeah, that's pretty much about my life. I know it's boring, like there is nothing much to say or nothing much to share, but this is what I am going through. If you are somebody who is following me for like from my first year, you will understand what I'm going through and how I was there. So since it's kind of a journal, YouTube thing is kind of a journal to me, where I give the updates what's happening in my life. So I thought, why not this, because today I just felt of just saying things out. And I also feel that nowadays I am not that much active that I used to be during my first years. I feel like I want to vlog, but I couldn't. Like, I feel like, oh, I need rest. Maybe this is because of the postings I'm having. I'm very tired. But like, it's kind of like I wake up every day at 6, and then I have to take the metro at 7:45, and then I have to reach college by 9, and then the OPDs, the extractions and everything. doing patients and then coming back home till 5 and then taking some rest and watching something, sometimes going out and having some adda, and it's just like that. I mean, I think I am bored, and I also like this boring life of mine. I feel like I have gone back to that era of being bored. Okay, so I wouldn't say I don't like it, but yeah, I am not very much active in social medias nowadays, and it's okay. I think that this is also a phase, and that's fine, that's completely okay. So yeah, if you enjoyed this video, do let me know in the comment section below in which year you are right now and from where you are watching. I just want you guys to show this beautiful sunset that I can see, like, so that you guys can appreciate it as well. So it's looking beautiful. The whole March is all about love season, because in Bengali we say it as Boshanto, and Boshanto means everything is very new, all the pains it fades away and new leaves comes out and flowers are blooming, and it's Dol Purnima, we Bengali says, and it's Holi in India. Many crows out here in the terrace, so yeah, they're also enjoying the whole thing, whole atmosphere. I don't know if you can hear music, but there is some music going on, and it's like the festival is happening. It has already started because tomorrow is Dol Purnima. So yeah, some Ravindra Sangeet is going on, and I love it. The whole atmosphere is beautiful, along with the sunset. And yeah, I will see you guys in the next video. Until then, take care. Bye bye.